Hello, my name is Miss Amanda Tozer. I'm a consultant gynaecologist subspecialising in reproductive medicine. I'm going to talk today about fibroids and infertility and the impacts fibroids can potentially have on your fertility. Fibroids are basically muscular and fibrous structures most commonly found in the uterus, and they are extremely common. They are usually found in 3 different sites within the uterus and are named accordingly. So, fibroids can be found within the main body of the uterus, and these are called intramural fibroids. Fibroids are found sticking off the side of the uterus, either partially or wholly, and these are called subserosal fibroids. And fibroids are also located either partially or wholly inside the cavity of the uterus, and these are called submucosal fibroids. The location is very important because the location is what may affect people's fertility. There is no doubt, and it's been shown conclusively, that those fibroids called subserosal fibroids that stick off the side of the uterus have no impact on fertility at all. So essentially we can ignore those fibroids. However, those fibroids that sit inside the cavity, partially or wholly, the submucosal fibroids, it has been well established that they do affect your fertility and should be removed in order to improve fertility rates and pregnancy rates. The most difficult group of fibroids are the intramural fibroids. It is hugely controversial as to whether we should be doing anything about those type of fibroids and whether or not they have an impact on fertility. So, subserosal fibroids we can essentially ignore. Submucosal fibroids we know we should remove, but the intramural fibroids are difficult. When you're seeking treatment for fertility, of course, you will undoubtedly have an ultrasound scan. And an ultrasound scan is one of the best ways of diagnosing fibroids and their location. You may be asked to have a further investigation called a saline sonography. This is where saline is instilled into the cavity of the uterus and can clearly show whether or not a fibroid is invading into that cavity. You may also be asked to have an MRI scan. This is usually when there are multiple fibroids and the location of all of those fibroids cannot clearly be identified by ultrasound scan. Certainly when it comes to treating fibroids, the main treatment of course is surgery. And for submucosal fibroids, a hysteroscopic myomectomy is performed. This is an extremely safe and effective treatment when performed in experienced hands, and is undoubtedly the right treatment. When it comes to making a decision about intramural fibroids and whether or not to remove them, again, this decision is essentially made upon whether or not that fibroid is causing problems in terms of symptoms of heavy bleeding, and certainly whether or not that fibroid is distorting the endometrial cavity. It is probably only those intramural fibroids that distort the endometrial cavity that are worth considering removing. And again, this decision often depends upon the size of the fibroids and the number that are there. And it is a decision that you would need to make with your fertility specialist. Surgical treatment of intramural fibroids involve either an open myomectomy or a laparoscopic myomectomy, again depending upon the size and location. Now, it is a very difficult decision often to make because of course surgery itself is not without complications. And overall, unless the fibroids are distorting the uterine cavity, removal of the fibroids has not been conclusively shown to improve your fertility. So, the most important thing is to be investigated and to make a good decision with your fertility specialist on how to proceed.